I was told by everyone around me that I had full symptoms of concussion. I learned really quickly that things could just change in a blink of an eye. A lot of professionals don't even know about my eye condition. I was told, well, you can go to Emerge, but you're gonna have to sit by yourself in Emerge because you're not a priority. And obviously the answer for me is no. To be honest, I was so out of it. I was in so much pain. I felt like I was my own like zombie world. Now that I think about it, I was like, wow, like all of this happened. So for those of you that might not know, like because of my eye condition, I've gone quite a lot of experience dealing with medical doctors and hospitals. And first and foremost, when I told the EMS that I do have a disability, this is my eye condition, and I feel like my vision is not what it normally is, I felt like it was kind of looked past. It wasn't really like they didn't really consider it as anything abnormal. I know a lot of times in my experience is that a lot of professionals don't even know about my eye condition. It's pretty black or white. It's like, okay, so you can see or you can't see, or they have never even really heard of the term or the name of my eye condition. So a lot of times I do have to take a minute or two and explain what it means. And even having said that, I said I don't, my vision doesn't feel the same, and I kind of told him like what I can see. I was still given the clear to go about my day, and just said, well, if anything changes throughout the day, go ahead and go to the Emerge, even though I was complaining of being disoriented and things like that. To me, in that moment, I am looking, for someone that has medical knowledge to kind of give me the guidance and to give me some sort of answer of what to do. Because at that point, you sometimes can't think for yourself. And I was told, well, you can go to Emerge, but you're gonna have to sit by yourself in Emerge because you're not a priority, and it's COVID-19. Do you want to sit by yourself in the waiting room? And obviously the answer for me is no. What am I gonna sit by myself in the waiting room when I also have a disability? And for me, the first thing is, how am I gonna navigate the Emerge? And I know with COVID-19, a lot of times, we have to maintain two meters, and people are sometimes reluctant to help and all of that. So I was looking for, someone in the medical that has medical knowledge and telling me what to do, and instead this was the answer I got. And now that I think about it, I feel like I really was not treated how I should have been treated, and just undermined and underestimated what I might have gone through. And then I called my family doctor during the day and saying, hey, this is what's going on. She's telling me go to Emerge because these are all signs of a concussion, and you did hit the back of your head. You need to go to the Emerge to get checked out. So I end up going to Emerge with my mom. And thankfully they did let my mom come in with me because I told them that I have a disability and I need my mom with me. Understand, healthcare professionals are overworked, they're burned, they have a lot on them, they're stressful. But guys, you need to be able to show some bedside manners. We are just as new to these new boundaries and things when it comes to COVID-19. You shouldn't be getting upset or angry or yelling at patients when they don't even know what they're supposed to be doing. So I had to sit in, for example, I had to sit into a chair so they could check my vitals and stuff like that during triage. And my mom was showing me the chair. Nurse started yelling at my mom and says, don't touch that, you need to stay far back. And my mom said, like, well, she's partially sighted, I'm not gonna touch the chair, I'm just guiding her towards the chair so she sits because she's unstable on her feet. And they're like, yeah, no, I understand that. I do COVID screening for work, I do disinfecting, I understand all of that. But at the same time, like, it's just, you know, like that was the first thing that happened. And to be honest, I was so out of it. I was in so much pain. I felt like I was my own like zombie world, just walking through the motion. Like I just wasn't able to even speak up at that point. Now that I think about it, I was like, wow, like all of this happened. We're waiting and waiting. We go, we get seen. Again, the doctor that came to get us from Emerge from the waiting room said, well, you can't come in. And he's like, so she can't see. And my mom then had to clarify and say, well, she cannot navigate through this right now, and she's also unstable on her feet. Yeah, when we go into the back, barely asks us any questions or anything like that. Just says, okay, it looks like you have whiplash, maybe a concussion, but doesn't really do any, or asks me any questions about concussion symptoms or anything. We go get x-rays done. We're sitting back in the Emerge waiting room. Mind you, despite being COVID, it was quite packed and no one was really social distancing. So I was very confused about that aspect. And then comes back and meets us in the hallway and just says, okay, here's your slip, you have no broken bones, and that's it. It was like, so you're not even gonna tell me or confirm that I have like whiplash, or like do we need to monitor for a concussion or anything like that? So anyways, I come home, and then a couple of days later I end up booking an appointment, a virtual appointment with my family doctor, and having a virtual call with them. And you know, they're saying, yep, okay, you know, you need to self-evaluate or do these self-assessments every week or every 2 weeks. And you know, for your concussion, it looks like you do have a concussion, and you know, you're gonna have to start doing physio, and you need to relax and take it easy and all of this jazz. Yeah, it's something very quite difficult to navigate, I think, on a regular basis, but also just having said that, like, with COVID-19, you don't get to see the doctors unless it's really necessary, and then when you do go to Emerge, you don't know what kind of treatment you're gonna get, how you're gonna be received. I honestly felt like, I don't know if it had to do with my background or my race or because I'm a person with color. No, like, I certainly feel like the way the EMTs and how I was treated at the hospital had to do with my color, coming from a background, a colored background, wearing a scarf. That's not a nice feeling to have. And then also stating that, you know, you do have a disability on top of that, and an eye condition, and at that time, not even, you know, that was not even a primary concern for them to see, okay, let's make sure that there's nothing wrong with your eyes, till I went 2 weeks later to my ophthalmologist and got my vision checked out because things were just not improving.